Welcome to Introspection, the podcast about moving from grief to growth. I'm Amy Lindner Lesser, your host. Introspection started out as a podcast about hospitality, innkeeping, and innkeepers. After about a year, I realized that my life and interests have morphed from hospitality to helping others navigate from grief and loss to growth and living. In this new version of Introspection, I will be talking about my personal experiences with loss, and there are quite a few, what I've learned along the way through my professional training, as well as from my coaching experiences. I'll also be bringing in guests to share interesting ideas. So grab a beverage, find a comfy place, take a deep breath, and listen in. Hi, everyone, and welcome back to Introspection, From Grief to Growth. I'm your host, Amy Lindner Lesser, and I'm really excited today. I have been trying to find somebody for about 2 years, and then found my guest today in a class that I took. My guest today is Dr. Connors. She works tirelessly to help others reach their fullest potential in life, helping and supporting others who have been oppressed, stigmatized, marginalized, and victimized. Her greatest passion is working with individuals affected by HIV and AIDS, substance use and mental health disorders, violence, abuse, trauma, grief and loss, and racial and social injustices. What Dr. Connors has gained and learned in her life is what she desires to offer others, knowing she's impacted someone's life in her aspiration. Her motto is, God has blessed her to be a blessing to others. Dr. Connors is the associate pastor of In His Image International Ministry in Maryland. She's a licensed clinical professional counselor, a licensed professional counselor, a national certified counselor, a board certified coach, and a master addictions counselor. As you can see, with her bachelor's in social work, a master's in divinity, a master of arts in professional counseling, and a Ph.D. in psychology, that's why I asked Dr. Connors to come and be my guest today. I know that there's a lot of confusion out there in the world about the difference between coaching and counseling and therapy. And Dr. Connors, welcome and come join me. Thank you so much for being here. When you introduced yourself to us in the first class, and I've now taken 2 courses with you, I was like, oh my God, you're perfect. You are the perfect person to help the confusion, to clear it up. So thank you so much for agreeing to do this. And for we've been able to finally merge our schedules.
Yes, definitely. And thank you so much, Amy, for inviting me. It's definitely a humbling experience, and I don't take it for granted, and I don't take it lightly. So thank you again.
Thank you. Do you mind if I call you Lisa during
That's perfectly fine.
So you have an amazing background. Can you tell our viewers a little bit about what made you choose the fields that you chose, and then how you ended up spending more time doing coaching than the counseling and the therapy?
Do you have a lot of time for me
You
to
have
share?
plenty of time.
I guess I can truly say when I was a kid, I grew up in a traumatic household, a lot of trauma growing up from not being with my parents, though my parents rejecting me, abandoning me. I ended up living with my grandparents for a long time and my godparents. And I don't know, I think there was just something that was, innate and birthed in me to be a helper or to be a supporter of others. And so my journey started. I really want to say, I can say, well, my journey started when I went to college, but I really do think now, as you're asking me this, Amy, I think my journey started a long time before that, because I've always been the type of person to support other people, help other people, sit with other people, be other people's confidants. I got to tell you something, Lisa. Please don't tell anybody else. And I was able to hold it. I'm telling you, there's things that, my friends told me when we were young that I still have held on to today. Now, I may have forgotten it, due to age and memory stuff, but I definitely have never shared it with anybody else. So I think, when I was a kid, I know that there was something that was birthed in me to be able to give back to others. And, I think also that my grandmother and my grandfather and my godparents, I do believe that they were instrumental in coming along and really facilitating, all the things that were there. And so definitely trauma. I'll just say trauma because I know that's our fanfare words that we always use. But, I like to say I grew up in a challenging situation or situations. And so that's how I started the field of social work, and the other things that I've done is to be able to give back what has been given to me. Now, fast forward to coaching. Well, I'll tell you this, I'm just going to be honest. in in my culture, I'm just saying the truth. We didn't know about counseling, we didn't know about coaching. So I didn't know about coaching until I started working in a hospice environment. And I do a lot of research, and I'm always looking up things, and I found out that coaching had been around since the 80s. So then I went back to think, I'm like, I was in high school in the 80s. I didn't know about coaching, not to the degree of what we're talking about. And so I started out in hospice, and long story short, I never really wanted to work with people dealing with loss and grief because I myself have dealt with a lot of loss in my life, loss of friendships, relationships, connection, loss of identity, loss of virginity, all of those things. So I really didn't want to work with people experiencing loss. And so my experience working in hospice actually changed my trajectory and also changed my lens. And I started out as a bereavement coordinator with this hospice organization. And from there, I said, there is much more to this, not knowing that I was going to land with coaching. And after, doing research, I have actually applied for a scholarship for coaching, won the scholarship, and was able to pay for my education to go to school to get my coaching credentials. And that's where I started.
I got my master's in social work in 1980. There wasn't anything called coaching because I might not have chosen to do social work. And I think for me, I got both burned out and frustrated with the field. That at the time in Pennsylvania, which is where I was living, anybody could call themselves a social worker.
Sure.
There was no licensing. And I worked in an agency that was to prevent child abuse and neglect. And there was a gentleman who was illiterate who called himself a community social worker. He did wonderful things, and I don't want to belittle him at all for that. He was a great resource person, hooked people up, but was he a social worker? No. And so that got me a little upset. And then I saw, as I continued in the field, I saw people seeing therapists for years and never coming to any kind of resolution or completion around anything. And I thought, something is not right here. Either it's not the right match between the two people, or maybe the therapist is not being a good therapist and they're looking at more, how do I pay my bills and let me keep this person coming? Or is the client or patient not sharing? Are they keeping everything aside so that they're not working on the issues? And so when I finally heard about coaching, I was like, whoa, this is really cool.
Definitely. And I think too, that's the reason we connected so well, because two things that you mentioned that resonates. I started out When I started out in social work, I did start out in child protective services. So I started out in child welfare. That was my first actual, I guess I can say, real job that I had. And then from there, I moved on to other things. And then the other thing that you mentioned is that I've seen this, and I still see this today, therapists seeing clients for 10 and 20 years. Now, no pun intended for those of you who are out there listening. That's not what I'm saying. At some point, when do clients have the capacity, or when do they have the ability to use all the skills that they've been given to move forward in life? And like you, Amy, I saw the same thing. Because I'm thinking to myself, you're in therapy and you've been in therapy for 20 years. And some people have said to me, well, Lisa, some people need to be in therapy that long. Now, it's nothing wrong with being in therapy for a few years or so, leaving therapy, practicing your skill. And then if you have to come back, come back. But being in therapy consistently, like you, Amy, I was like, something else has to be going on here. What can I do? What's going on? What do we need to do different that's going to help people navigate their life in a way that seems meaningful for them? And I believe, and this is what I believe that when people show up, they show up with what they show up with. Because think about it this way, they got here, right? They survived something, they thrived somewhere. So, what was it that allowed them to thrive? They're here, right? You think about a person who's 45 years old or 50 years old, they survived something. And like I tell people all the time, we all have a story. Every single one of us, from the top to the bottom, we all have a story. So then I go back and think, well, how did they get here? They did something to get here. They pulled from whatever was on the inside that facilitated their journey to get here. And so, one of the things as a clinician, as a therapist, I think that sometimes we can, no pun intended for those listening, I think sometimes we can allow people or clients and patients to become dependent on us, that they don't move forward. They don't move in the places and spaces that's very meaningful for them. And so, like you, Amy, I decided that, I want to do this coaching. I don't know what I'm doing. I don't know what it is. I'm not even sure I'm going to be great at it. I mean, somebody please help me. But I took a dive. I took a dive and I said, I'm going to do this. And I've been doing it for several years now. And I love it. I love it because I get to see people's lives change, not for the better, just changing in the way that is really, really meaningful for them.
I think that's probably the biggest difference. But I'm going to ask you if you could sort of define so that we can understand the differences between therapy, counseling, and coaching.
So I'm going to start with counseling first. And the reason I start with counseling first is because I want to say that counseling, I'm not going to say it's benign, but that is the first step when someone have gone through loss. So working in a hospice organization, I was a grief counselor, and I also was a bereavement coordinator. So people who had experienced loss would come and see us for counseling. Now, most of my colleagues who are grief counselors that's working with people experiencing loss, many of them, not all of them, but quite a few of them work in hospice organizations. And so most of the time when we say grief counseling is going to be short term, right? It's not going to be 55 sessions. It's going to be probably 6 to 8 sessions.
Almost immediately after the loss.
Most of the time, yes. Yes, almost immediately after the loss. Because when people come from counseling, many times they already have healthy coping mechanisms in place. So they don't need a lot of, I want to say, I guess I can say care, because they have resources, they have great support systems, they know how to navigate things in their lives. So it's going to be more short term. It's going to be about maybe 6 to 8 sessions, probably 8 at the most. I will say to you that when I worked in hospice, one of the things that we used to do, we used to actually see clients indefinitely. But then right around the time I was getting ready to leave, they changed the policies. And they said, now when clients come for grief counseling, we're only going to give them a limited amount of sessions, which was 8 sessions. So usually if you're doing counseling is going to be very limited. It's going to be very, very limited. Again, think about these key points. The person have healthy adaptations, that pretty much they have healthier coping skills. They know how to navigate their life. They have great resources already in place. And when I talk about resources, not just money, resources are people. And they have and they really have a great support system. And so they're coming to just navigate the loss that they've experienced. Now, let's flip over. And again, let me just say this. People who do grief counseling are licensed clinicians. They are licensed in social work and they're licensed in counseling, and some of them may even be psychologists. But my colleagues that I knew, they were all licensed. All of us were licensed in counseling and social work. It's just that it was very, very short term. And oftentimes, if you go to like EAP, employee assistance programs, they're going to work with you, but they're not going to work with you long term. They're going to work with you short term. So that's the difference. Knowing that people have the mechanism to have all of the tools in place to navigate their experiences, because what they're doing is they're going through the normal and natural reactions to their loss. There is nothing maladaptive there, and they know how to navigate their life. So that's grief counseling. Now, let me just flip over to grief therapy. So when I was working in hospice, we could not call ourselves grief therapists because we were not therapists. That was not the role. Because the difference is, yes, people are going through normal reactions to loss, but this is where therapy comes in. Therapy comes in when people oftentimes, I don't want to say can't, but it's very difficult for them to navigate that loss experience. And so their lives start to change. They start to slip deeper and deeper into their loss and into the grief. They don't get up in the morning. They don't brush their teeth. They don't go to work. They stay in the bed. They don't take showers. And this is something that's happening consistently. Now, I talked about grief counseling. Those persons, they still get up. They go to work. They do the natural and normal things that they need to do for their lives. They're just responding to the loss. And they're really exemplifying those reactions to the loss that they've experienced. But people who are in therapy, they need a little bit more, I don't say help, support. And that's where it comes in, where we get really involved. There are more deeper issues. And I want to say deeper, quote unquote. There are more deeper issues that the therapist is going to navigate with the client. Because think about it. If I've gone through loss, I'll just use that as an example. And when I was growing up, I was molested as a child, and I never dealt with that molestation. So oftentimes, this is what I say. When people go through loss, and I've seen this in many different scenarios, loss and grief has a way of bringing up other things that was lying dormant. And so that is the difference. And the therapist is going to work with that client or that patient on deeper issues. That's where the therapist is going to come in and do some diagnosis. That's where the therapist is going to come in and assess. That's where the therapist is going to come in and do treatment plans. So for instance, not to say that counselors cannot do that, but where I see counselors working is working with clients where it's more, I guess I want to say, and I hate to use this word, it's more benign. I guess I can use that word. But when it's therapy, it's going to be a lot of other maladaptive issues going on, a lot of complicated grief where people are just sinking. They're not moving. They're not doing anything. And they're sinking deeper and deeper and deeper into their experience. And so the sessions are not going to be 8 sessions. You're talking about 20 sessions, maybe 52 sessions. You may be talking about working with this person for several years as they're trying to navigate their life, as they're trying to make meaning out of their life. So when you think about therapy, therapy is where we go in and assess. We do a lot of assessments, we do a lot of diagnosing, and we do treatment plans, because that's the difference between therapy and counseling. And if I had to give two words, I would say, I would say counseling is more benign. Therapy is going to be more maladaptive, more of digging down deeper to some of the issues. And we also find out that when people are in therapy, there might be other issues that's going on as well, other things that we diagnose. Maybe the person might be bipolar. Maybe the person might have other mental health disorders. Maybe the person may have substance use disorders. So that's where we do more deeper work. Now, any questions, Amy, before I go into coaching?
What I was going to say is this may be very simplified, but in counseling, it's more situational, that it's the loss, whereas in therapy, there are other issues in that person's life that made their life, even before the loss, complicated. And they were having trouble navigating their own life. And as you said, may have been using substances, maybe overeating, maybe having bouts of anger, whatever those other issues are. When you add a loss to it, it complicates it and it sort of blows it up out of the ability for many of the people to function normally.
And however you define normal, whatever that means for most.
In their normal, we'll put it that way, in their normal.
And typically people, and you made a great point, because typically people who are in therapy are experiencing the complications of it. So that's where that complicated complicated grief comes into play.
That for many people, probably most people, I couldn't give you a percentage, I'll say 95% of people experiencing grief will manage to walk, maybe putting one foot in front of the other for a few months, a year. And outsiders may not even realize that they're still dealing with deep grief within, but they're functioning. Whereas somebody who needs therapy or who would benefit more with therapy are not functioning well.
They're not functioning well. And oftentimes when you see people in therapy, they may not always have those mechanisms in place to help them navigate life.
Life quakes or life transitions and the aftershocks that follow are something we all experience. A life quake can stem from the heartbreaking grief that arises from the loss of a loved one, or the disorientation felt when life suddenly shifts due to the loss of a job, relationship, identity, or health challenge. Learning to navigate these transitions with mindfulness, grace, and self-compassion is the key to finding your way back to joy, happiness, and inner peace. Advanced Grief Recovery Method Specialist and Certified Life Transition Coach Amy Lindner Lesser, MSW, expertly supports clients to navigate their life quakes and transitions with warmth, kindness, and grace. Learning to accept support as you navigate your way through the aftershocks is one of the most powerful gifts you can give yourself. Learn more at introspection.com. That's introspection.com.
Okay, now let's bring coaching in. So what is it with this new kid on the block?
Yeah, it is new kid on the block, and we ain't even singing the right stuff. And so coaching is very, very different from counseling and therapy. Coaching is more movement. So when you think about counseling and therapy, so I'll use that as an example. Counseling and therapy is more about processing. What is it that I need to process that I haven't processed? When we think about grief coaching is about action. Because I always tell people, if we're holding fast to the fidelity of what coaching is about action. It's about movement. Now, can a person be in therapy and coaching at the same time? Sure, they can. Also, we want to make sure that the client understands the difference. So when a person comes to coaching, they are ready to move forward in life, whatever that loss might be. Now, I just want to put a pin there. I want to say that oftentimes people think when people are experiencing loss and grief, it's because someone has died. I just want to make a correction there. If you, and I'll say this, wholeheartedly, most of the clients that I've worked with have experienced non-death, DEATH, because somebody thought I was saying DEAF or DEAD. So non-death loss, meaning that it was not even associated with death. It was associated with the loss of my home, the loss of my career, the loss of my identity, the loss of relationships. So it didn't have anything to do with death. And so when people come, many people are ready to move forward in life and really looking at what does that really look like for me? So grief coaching is supporting people and being with them. Now, I'm not saying that therapists and counselors can't be with their clients, but there's a difference to it because they're practicing, and grief coaching is all about skill based. It's all about, going out and implementing, going out and moving forward and doing the action steps. And this is what I said just recently. I said, think about a coach on a football field, basketball court, or soccer field, or what have you. The players, they know the plays because they practice them, right? The coach is there to ensure that they implement those plays. The coach is there to ensure that they keep those players accountable. So when it comes to grief coaching, as a grief coach, it's up to me to ensure that I keep my client accountable or I help them stay accountable. And they know the plays. They know exactly what they want to do. They have the action steps in place, but I'm on the sideline. So again, think about coaches on the sideline. Did you do that? What happened? What transpired? Okay, I see that. Wonderful job. You got that. That's what we do as grief coaching. So the difference is with grief coaching is the fact that people come in and they start to visualize their life moving forward. And what is that going to look like for them? So this is what I usually do with clients. I ask them to envision. Where do you want to be? Where do you want to be? I just want you, if you can have anything in the world, and we're talking about, grief coaching, we're talking about loss. It could be a divorce. It could be somebody gone through divorce. And so they envision being married again. So I usually ask clients, so with that being said, let's backpedal. Let's backpedal so that we can begin to start walking with this, putting some things in place so that you can get to the place and space you want to be. So with grief coaching, it's visualizing life going forward. It's sitting with clients as they're rebuilding their lives. It's also helping them and supporting them as they're identifying. So if I'm moving forward, what are some of those things that might get in my way? And so it's walking with the client to help them identify these are the things that's getting in my way. So let's talk about that. So these are the things that's getting in your way. What have you done before that have helped you? So it's pulling out what people already have in place. It's not processing. It's all about action. Most of the time when we do counseling and therapy, it's going to sometimes with counseling and therapy, we're going to look at the past. But with coaching, we look at the present and we also look at the future as well. Because what we're doing is walking with them as they're continuing not only to rebuild their lives in the way that seems meaningful for them, but it's also identifying with them how they can refocus on their life and how they can refocus on life's possibilities. And so that's the difference between coaching. Coaching simplified is more about action. And being a coach, sitting on that sideline, helping and supporting the client to implement those action steps. But if you're looking at it from sports, helping them to implement the plays.
And being a cheerleader.
Yes.
Running along the sidelines and cheering them on.
Yes, you got it. You can do this. Great job. Yes, yes.
And I think what you alluded to, but didn't come out and quite say it, was that coaching is client initiated and led. That it's much more from the individual who's seeking the assistance rather than the coach telling. Not that suggestions aren't occasionally made, but that it still is coming from the client.
Yes. And the ownership is on them. The ownership is on them to implement those plays. It's on them, to move forward in the places and spaces that they want for themselves. Because if I am a client and I said my ultimate goal is to be married again, I can't go on a dating app for you. That's something that you're going to have to do, because if you're looking to go in those places and spaces, to integrate yourself back into the dating scene, then those are the things as a client that you do. So you are right, Amy. It is more client led because the ownership is on the client to move forward in the place and space that they want to move forward in.
The accountability is all on the client. Whereas in coaching, in counseling, and in therapy, often the professional will sort of pull somebody along a little bit more.
Yes.
But it's like if somebody doesn't show for a call, in any one of these options, the professional can say, okay, you've missed your call. A coach is probably more likely to say, even at that first time, is this what you want to do? Take responsibility for your actions or your inactions. And, we can talk about it, but it lies with you, as opposed to me saying, okay, I'll see you next week.
Yeah, it lies with them. It lies with them. And one of the things that I do with clients is I do a lot of scaling questions. That's where that motivational interviewing starts to come in, because I'm asking them, how, important is it to move forward in this space? How confident, are you that you can move forward, and how ready are you to move forward? Those are the questions that I do put out there, because at the end of the day, it's really left up to the client to decide, am I ready to move forward in this? It's going to be up to them. It's not up to me. It's up to them. And that's where, I read this somewhere. I read, when we give people choice and control, you are going to have a different outcome. You're going to have a different outcome, because you're giving them choices, right? Kind of goes back, yes, to social work and counseling, autonomy. When you give people choice and control, you are going to have a different outcome. So I think a lot of times that's where the coaching comes in. And again, as a therapist coach, I'm not saying that, therapists don't do that or counselors don't do that in their practice. I just want to say that in coaching, there is that accountability. As you said, Amy, they're cheerleading the client on, and also giving them choice and giving them, control over what is it that I'm going to do. So I might say, out of everything that we talked about today, what is one thing that you're going to do, or what is one action you're going to do, before I see you next week or before you come back? And so that's going to be up to them. It's not up to me. It's going to be up to them, because if they want change, then it's going to be up to them to change the things that they want change.
I think that's a really important point. In my experiences with counseling and with therapy, it was rare to have a quote homework assignment that you went from week to week and nothing may happen during the week. You may never think about the previous session. But with coaching, there's almost always an assignment. And doing the assignment is going to make a difference of whether or not you do move forward in what your goal is that you've set. That, if you won't do your homework, then nothing changes. And you're wasting time and energy and money that's yours. The other thing is that other than EAP programs, most insurances that I know of do not cover coaching. So coaching is self-pay only.
Yes, self-pay only.
And that's important to know, because if you don't have the money, then it may leave you out unless you find somebody who's willing to work with a sliding scale.
Yes.
It's not impossible. There are always people who will do things for sliding scale or in exchange for something. I heard, and I know you've heard him talk, and I can't remember his name, but about, well, if you can bring me another person for the group program that I'm offering, I'll give you yours for half price or for free. And there are all kinds of creative ways that coaches work in both setting fees and even in coaching.
Yes.
I think the thing that got me so excited about coaching, and now I'm not going to be able to remember the name of the show. There was a TV show on in the late 90s, and Ayala Van Zant was one of the coaches. And it was a group of women, like 8 women who came to live in a house together, and they were coached through their lives. And one of the things that I absolutely loved were the kind of assignments that these women were given to deal with their issues. I remember one had to stand on a street corner and say hello to people because she was afraid of being out there in public. And that's one of the things that I loved about coaching is that the sky's the limit for the kind of assignments that you can give. And you shared with my class, both classes, a lot of resources, things that, I would never have expected to use in a coaching session. So I use some of the cards that we have. I draw cards. We, not everybody journals. So asking somebody to write something may or may not work. I had a client and I asked him to send me a picture of what something looked like so I could see that it was done instead of him just saying, I did it.
Right.
Another assignment for the same person who said that he really enjoyed taking photographs and was looking for an outlet. So I said, then go out. You love sports, go out and take pictures of the teams playing. And he was like, oh, okay. It's not what you expect, but yet the results can be amazing.
It can be amazing if given the opportunity. It can be amazing. And I think, the important part is educating ourselves and educating, the people we're connected to, our networks about coaching, and that it has some wonderful, wonderful benefits.
Is there sort of like an ideal person who would benefit most from coaching? Like, can you say if this is the kind or where you are in your process, coaching is something you should consider?
Well, for me, I usually don't work with a client after the loss. I give it about a year because people are still trying to navigate whether someone died or whether, again, it's a divorce. People are still trying to figure all of these things out. They're trying to figure their life out. So they may not necessarily be ready to move forward. Because if you're moving forward is all about action. It's almost like putting one foot in front of the other. And if I'm going through probate court, if I'm going through family law court and trying to figure out custody and child support payments, I'm not going to be ready to be coach. But for me, and again, all coaches are very, very different. No two coaches operate or practice the same way, or have their businesses set up the same way. I think giving people a year, because think about it. If somebody's gone through a loss, they need that time to sit with what they've gone through. And after that year, if they're ready to move forward, then they move forward. So I can't say there is a quote unquote ideal client. I will say that for me, it's a year after the loss that I start seeing clients.
And with, let's say, a job loss or the loss of a dream, I'm thinking, I'll think of myself like infertility. That was something, that coaching would have been great. After a job loss, I don't think you necessarily want to wait a whole year.
You don't want to wait. No.
Death or a divorce, maybe.
but not job, not fertility, unless there is some deep-seated things there that the person is still trying to navigate. Because also, again, remember, there could be some deep-seated issues there that the person never really dealt with or even processed in their own life, because it could be old things that are still coming up. Okay, why can't I have a baby? So it could be, that self-defeating mindset or those thoughts, which, if it's complicated and people are not journeying forward or taking that journey, then maybe therapy might be the best at that point. Again, I'm not going to wait a year for the job loss. And also, I want to be vigilant too, that if I am coaching someone who've gone through a job loss and then they start talking about other stuff, where I was this in my family, nobody loved me, I'm just sitting here, I'm no good, and that becomes consistent, then we certainly need to address that as well. And if the person is stuck, that's where we help them walk the journey and get unstuck. But if it becomes so consistent that they're not hearing, some of the tasks, they're not doing any of the work, and they're just sitting there, then maybe coaching may not be for them at this point. So we also have to be vigilant about where people are at too, because people, oftentimes, well, when people come to coaching, they are ready to move forward. Sure, they are. And we also want to be mindful too that other things can rise up as well. And so we definitely want to make sure that our eyes are open to ensure that if that is happening, that we walk with the person to get them where they need to be, that's going to be most productive for them.
And as you said before, someone can work with a coach and with a counselor or therapist at the same time. And that's very helpful for many people.
Oh, most definitely. And I often tell my clients, I do have clients in therapy that are working with coaches. I have coaching clients that are working with therapists. So at the end of the day, it's not up to me. It's up to them to decide, what do you need? What are those layers that you need in life that's going to help you be where you want to be? And if it's, to be successful in your marriage, to be, just to be this wonderful person that's blossoming. I don't know, whatever that is, having a therapist and a coach, there is nothing wrong with that. One of the things that I do tell my coaching clients is, I do tell them that if you are, going to work with a therapist, well, they'll let me know. But for my therapy clients, they'll say, I'm working with a coach. So sometimes I do encourage, not that a coach or a therapist can tell you what to do and what not to do, because they don't have the authority to do that. It's up to the client. But just being respectful to let your therapist know that you are seeing a coach, and the coach know that you are in therapy. And I think most of the time, and what I've seen when I've coached, my clients have said, you know what, I am working with a therapist. So it's not that you have to, it's just out of respect.
Is there anything that we have not covered?
I would just say that people just be open minded to what coaching is all about. As I said before, we've all gone through many different things in our lives. Losses have happened to all of us. I mean, if we think about, and I hate to use this, if we think about COVID, all of us experienced some type of loss. So if you are interested in coaching, just open your heart and mind to receive it. It doesn't, we're not saying it's replacing counseling and therapy. That's not what we're saying. It's another level. It's another level or layer, if I can say that, of support. And so just be open minded, to embrace it, because I think at the end of the day, you'll get some wonderful benefits from it.
I think that's great. And with COVID, you know, people think of the people that they lost, because I don't think there's anybody on this earth who doesn't have some connection to somebody who passed away because of COVID. Yet that's the smallest part of it, and I don't want to belittle it, but the fact is that every single person in this country and probably in the world had to change their entire lifestyle because of COVID. We learned to do things remotely by Zoom, by FaceTime, by whatever it is, because we couldn't get together because we were afraid of that. We lost that human connection. And I know for me, I moved during that time to an area where the only people I knew were my daughter, my son-in-law, my granddaughter, and my son-in-law's parents. I had no friends. So here I was during a time where nobody was going out. So even though normally I would have gone to a synagogue or a church to meet people, they weren't having services in person. Groups weren't meeting together.
No, they were not.
What I missed the most was having somebody I could hug, not a sexual thing, just the physical touch,
Yes.
just the physical connection with somebody else. We've all had to learn to deal with less of that, which is not good for our health.
Yes, yes. And we still are in that space and place. People have not gotten back to, hugging like we used to because for fear of, getting COVID, which is still very real.
Or even handshakes.
Yes.
Don't shake hands, they fist bump, they elbow bump.
Yep, that's it. That's right. You hit it on the dot, Amy. That's what they do.
That's what, we've become, and that's a definite loss. I wanna remind our viewers that grief is a normal, natural emotion when there is a change in any relationship. That, as you said, it's not death only. It's not divorce. We can grieve over something that's relatively happy.
Mhm.
When I moved, I sold my inn and moved from Massachusetts to New York. I left behind a 25-year career, thousands of guests, a community that I was active in, that everybody knew me, a community I loved, and moved to a strange place. I was very happy for the move. It allowed me to do a whole lot of things. Yet I grieved for everything else that I lost. And I jokingly have told people that I grieved when my older daughter started to walk.
Mhm.
I grieved for the loss of her babyhood, but also, and it's gonna sound silly, but it's very real, I grieved for my loss of complete privacy. I could no longer go to the bathroom without somebody walking in. That it was like, "Oh, okay." Now, I'm stretching it. I would never have needed coaching or counseling or therapy for that, but it's a loss that we grieve for. And as a society, we do a really bad job of allowing people to show emotions that are difficult for the rest of us who are viewing them.
That's right. That's right. And the people who are on the other side of those emotions find it very uncomfortable to sit with people who are experiencing some type of loss.
One of the best lessons that I learned in my training with grief recovery method was that the listener, and it doesn't matter who the listener is. It could be your next door neighbor, the garbage person. All they need to do is be a heart with ears. And I love the visual. Don't say a word. Just sit and listen. That's what people need.
Definitely. That's the beauty of it. Just sit and listen. That's why God gave us 2 ears and 1 mouth
Yep,
to listen more.
it's true.
Mhm.
Lisa, thank you so much. And for guests who are listening, if they want to get in touch with you, what would the best way to do that?
So the best way to get in touch with me is you can reach me via phone. I'm going to give you my business number. It's 410-449-0222. Again, let me repeat it. It's 410 449-0222. Okay, that's probably the best way to reach me. And then if you reach out to me and if we want to connect via email, we can do that as well. Because if I give you my email address, which I gave it to somebody, and it took them like 5 minutes to get it. So I'll just give you my number, and you can always call or text me. And then if we want to connect via email, we can do that as well.
And I also know that Dr. Connors she's continuing as a professor, and I'm guessing she has students who need placements, and she may be willing to work something for people who cannot afford coaching.
I do offer some pro bono. I also offer a sliding scale as well. And so, my goal is for people to come and experience and explore the ability to move forward in ways that they may not have imagined before.
I believe that everybody should be able to get the help that they need and want without regard to what's in their pockets.
Yes, I agree. I agree.
Most of us, I think, are willing to work with people. We are creative people, which is why we're in this field. And we're empaths, which means we care an awful lot about everybody else. So we will do what we can do to help. Thank you so much for being my guest.
Thank you for inviting me.
Oh, my pleasure. Thanks, everyone. And remember to watch us again in 2 weeks. I'll be back, just me. And remember to make it a great day. It's up to you. I love you and I appreciate you. Bye for now. If you liked what you heard on this podcast and want to hear more, please follow us and tell your friends. You can also find me on Facebook at Amy Lindner Lesser, Grief to Growth Life Coaching, and on LinkedIn at Amy Lindner Lesser. Thanks again